What if I told you that trusting your doctor and questioning the diagnosis are not opposites? Most people think these two ideas cannot exist together, but they can. In fact, the patients who often receive the best care aren't the ones who blindly accept every diagnosis. They are the ones who respectfully ask thoughtful questions. Today, we are going beyond the video you just watched. The video is given it's attached to the podcast. You can watch it if you have not watched it. And we are not going to repeat the five warnings that you've seen there. Instead, we are going to uncover what those signs really mean, why they happen, and the surprising truth that almost nobody talks about. And before this episode ends, I will reveal the one mistake patients make that quietly increases their chances of living with a wrong diagnosis for months or even years. My name is Yaqub Ali, and welcome to the first podcast in this series, the the series of misdiagnosis. The five signs your diagnosis is wrong. Don't trust your doctor blindly. What the video that you watched didn't tell you. The video gave you five warning signs that a diagnosis deserves another look. But here is the question nobody asked: why do errors happen in the first place? Most people imagine a careless doctor, but real life is rarely that simple. Imagine solving a 1,000-piece puzzle, except half the pieces are missing. Some pieces belong to another puzzle, and several pieces keep changing shape every day. That's what diagnosis often looks like. Doctors don't see diseases, they see clues, symptoms, blood tests, scans, physical examination findings, medical history, family history, lifestyle. Every diagnosis begins with a hypothesis. The challenge isn't naming a disease. The challenge is deciding which explanation fits the best available evidence. Now, here is something fascinating. Sometimes the evidence itself is misleading, and that is where our story becomes more interesting. Now, imagine the body tells two stories. Let us imagine two people. Both have chest pain. One has acid reflux, the other has heart condition. The symptom is nearly identical. The cause is completely different. Or consider fatigue. Fatigue could result from poor sleep, anemia, thyroid disease, depression, an infection, a medication side effect, or something entirely different. One symptom, many possibilities. That is why experienced doctors don't diagnose problems, they diagnose patterns. But here is a twist. Sometimes the pattern changes. Early diseases often look different from advanced diseases. Symptoms appear gradually. Laboratory results change. New clues emerge weeks later. The means today that means today diagnosis may legitimately need revision tomorrow. And surprisingly, that's not necessarily a mistake. That's how medicine evolves as more evidence becomes available. But what happens when patients misunderstand that process? That is where things become complicated. The hidden psychology of diagnosis. Here something Here is something I have noticed. The moment somebody finally hears a diagnosis, they often feel relieved. Finally, an answer. Finally, a name. Finally, something to explain months of uncertainty. But what if that relief becomes a trap? Psychologists call it closure. Once we believe we have found the answer, our mind naturally stop looking for alternatives. Doctors experience this, patients experience this, families experience this. Everyone can become attached to the first explanation that seems to make sense. Now imagine this. What if the diagnosis explains 80% of your symptoms but ignores the remaining 20%? Those missing pieces matter. Sometimes they are small, sometimes they are the clue that changes everything. Which brings us to the question, Very few people ever ask themselves, what if you were part of the diagnostic team? Not the diagnostician, not the doctor, but an informed participant. Think about it. Who knows exactly when the pain started? Who remembers the unusual symptom from 6 months ago? Who knows which medication caused a strange reaction? You do. Patients carry information that no laboratory can measure, and yet many appointments rely entirely on memory. Imagine walking into a detective's office and saying, I think something happened sometime last year. Not very helpful. Now imagine bringing a timeline, a symptom diary, a medication list, copies of previous reports. Suddenly, the detective has evidence. That is exactly what happens in medicine. You aren't replacing your doctor, you are helping him see the whole picture. And here is the biggest surprise of all. The most valuable contribution isn't another test, it is often better conversation. The truth about the five warning signs. Remember the mystery I promised at the beginning? The biggest mistake patients make isn't trusting their doctor, but it isn't questioning their doctor. It is believing those are the only two choices. Healthcare isn't a courtroom. There doesn't have to be a winner and a loser. The goal isn't proving a doctor wrong. The goal is understanding whether the current diagnosis still fits the evidence. The five warning signs aren't proof that your diagnosis is incorrect. They are signals that deserve thoughtful discussion with your healthcare team. Sometimes the diagnosis will change, sometimes it won't. Sometimes more tests are appropriate. Sometimes careful follow up over time provides the answer. The real power comes from asking questions like, how does the diagnosis explain all my symptoms? What finding supports this diagnosis? What other possibilities were considered? What would make you reconsider this diagnosis? Those questions don't create conflict, they create clarity. And clarity is one of the most valuable outcomes in healthcare. Final reflections. If there is one idea I'd like you to remember today, it is an accurate diagnosis isn't built on trust alone, nor is it built on skepticism alone. It is built on communication, evidence, observation, reassessment when needed, and partnership between patients and healthcare professionals. The strongest patients aren't the one who know the most know the strongest patients aren't the ones who know the most medicine. They are the ones who know how to participate thoughtfully in the diagnostic process. Sometimes the most powerful thing you can say isn't I think you're wrong. It is can you help me understand? That single question can transform an appointment. In our next episode, we are going to answer one of the most practical questions every patient should know: how to get a second opinion and avoid medical mistakes. When should you seek a second opinion? How do you do it without damaging your relationship with your doctor? What records should you carry? What questions should you ask? And how can a second opinion increase your confidence, whether it confirms your diagnosis or points towards a better explanation? We will explore all of that in the next episode. Until then, stay curious, keep asking thoughtful questions, work with your healthcare team, because the journey to the right treatment begins with the most accurate diagnosis possible. Thank you.